And we're going to do just a little bit of a review. So we've covered the entire original Medicare side of the chart. So we've talked about original Medicare from the government. We've talked about a Medicare supplement plan that pays you out-of-pocket cost up here, and a prescription drug plan that helps out with the prescriptions. Now, this is the side that gives you all the choices. You can go to any doctor or any hospital that you choose as long as they accept original Medicare. That's the only requirement. And when you go, you don't have any out-of-pocket costs because between Medicare and your supplement, depending on the plan you pick down here, they're paying for everything. And this is the plan that gives you no managed care. So what the doctor orders is what you get, with very few exceptions. Now, your other option is Medicare Advantage. This is also called Medicare Part C. And what happens here is, folks, you continue to pay the $134 a month for Medicare Part B. That doesn't go away. You must keep paying that. But now Medicare sends that money over to this private insurance company that you choose, and they combine your coverage and they administer your health care for you, but they take Medicare out of the picture. So now it's just you and the insurance company, and you play by their rules. These are the HMOs and the PPOs. Now, I want to be very clear here. You do not lose Medicare. You're still in the system. But what's happened for that calendar year that you made that choice, Medicare has now contracted you out to this insurance company. They say, here's the money, you take care of them. That's a Medicare Advantage plan. So we'll take a look at what Medicare Advantage plans look like. It's also called Medicare Part C. And what's the first thing you notice about Medicare Advantage plans? We are no longer comparing apples to apples, are we? Every plan from every company can be completely different. Now, the advantage is that in addition to the $134 a month that you are going to continue to pay for Medicare Part B, you will pay little or no additional premium for your plan. Now, again, these numbers are just made up. These are not the real numbers. Quite a few of the HMOs still have a 0 monthly premium. But the PPOs, some of the HMOs and all the PPOs cost money. They can be pretty expensive. Some of the PPOs can cost as much or more than a Medicare supplement. So you have to be careful. Now, where you will pay is when you use the insurance. Now you're back to out-of-pocket costs. You have co-pays and deductibles and co-insurance. So when you go see your family doctor, well, you're going to have a co-pay there. Now, a few of the HMOs still have a 0 monthly co-pay or 0 office copay. Quite a few of the HMOs now have an office copay, and all the PPOs have an office copay. You go see your specialist, you're definitely paying a hefty copay there. You go to the hospital, you're paying either a co-insurance or a per day copay for a certain number of days. You go for an outpatient surgery, you're paying a portion of that bill. All your testing, diagnostics, MRIs, CAT scans, all your blood work, your emergency room visits, your urgent care centers, you're paying a portion of those bills out of your pocket. Now remember, Medicare's out. They said, here's the money, you take care of them. And so now who gets to set the prices that they pay the doctors? The insurance companies do. And this company pays that doctor a little bit less than this one does. And this company pays that doctor a little bit less than this one does. And this company pays it on down the line. Now we have doctor networks. So you all remember what a doctor network is. It's a list of doctors that you can go to. Now, if you have an HMO, that's very strict. You really only can go to their doctors. If you go anywhere else, you're just on your own. They're not paying a penny. Now, the PPOs are a little bit more open. They'll allow you to go to out-of-network doctors, but what do? You pay the out-of-network price, which can be 2 or 3 times the in-network price. And now, because we have networks, we also have a geographic service area where we have to live and obtain our services. If you travel or move out of the service area, well, guess what, folks? Your insurance may not work. Now the HMOs, some of the HMOs can be very small. They may only cover 1 or 2 counties around where you live. And if you live on the wrong side of the tracks, well, your insurance may not work in the town where you want to go to the doctor. So imagine you've got your family doctor is in your county where your insurance works, but she refers you to a cardiologist in the next town over where your insurance doesn't work. So now what do? You go back to your family doctor and say, Doc, I'm sure that's a great doctor that you just referred me to, but I can't go there because my insurance doesn't work in that county. Please find me another doctor that takes my insurance. Or if you move out of the area, you may have to find new insurance. Or here's one that comes up all the time, pretty often. Unfortunately, it comes up pretty often. A lot of people have to go out of town for things like cancer treatment. You know, we're in Texas, and MD Anderson Hospital in Houston is the premier cancer hospital probably in the country. And a lot of people go there for their cancer treatment. And folks, some of these HMOs, they don't work there. They just don't work. And they may work fine where you live, but they don't work there. So we have networks. Now, the other thing that we have with Medicare Advantage plans is something called managed care. Now, what that means is that the insurance company is making your healthcare decisions for you. Now, they sell it to you like it's a good thing. We're going to manage your care. Don't worry about it. We'll manage your care for you. What are they really managing? They're managing their cost. You see, some of these plans are only getting paid $134 a month, just what you're paying to Medicare. Folks, that doesn't pay the bills. So they have to cut costs. And, you know, to be fair, these companies are in business to make a profit. And one way they cut costs is they don't pay the doctors very much. They pay the doctors less than what original Medicare does, or less than what a group insurance plan does. And another way they cut cost is by saying no a lot. Folks, for anything that's not a life and death emergency or just a regular office visit, you have to get permission from the insurance company first. And they can, and on the Medicare side, often do say no. Now, they're not going to say, no, you can't have that treatment. They're just going to say, no, we're not going to pay for it, which for most of us means what? You can't have it because you can't afford it. That's why you have insurance. And with managed care, now you have to have referrals to go see specialists. Now, some of the PPOs will say, sure, go to any doctor you want to. You don't need a referral. Just tell them to send us the bill. And what's the catch to that? You have to find a doctor who's willing to accept that insurance and pay whatever small amount that they're going to get, accept whatever small amount that they're going to pay them. A lot of doctors are just not willing to do that. So that's two things you've got: networks, managed care. The other thing you have is a one-year contract. These companies have one-year contracts with Medicare, one-year contracts with the doctors, and one-year contracts with you. Any one of those three things changes, and now you're either shopping for a new doctor or shopping for new insurance. Now, you can only change plans once a year during the annual enrollment period from October 15th to December 7th. And once that December 7th deadline passes, you're now stuck with whatever plan you have or new plan that you pick starting January 1st for the whole next year. So here's what happens. You get a Medicare Advantage plan, and I call you up on October 15th and say, hey, it's time to review your Medicare Advantage plan. You say, no, Ron, it's working fine. I didn't pay anything because you didn't get sick, and I don't have time. I don't want to mess with it. And I say, yep, no problem. What you didn't know, and I didn't either because there's too many doctors for me to keep track of, is your doctor didn't feel the same way about that plan. Your doctor said, you know, that plan right there, they didn't really pay me very much, and they didn't really pay me on time, and they were kind of a pain to deal with. So next year, I'm not going to take that plan. Now, do you think that doctor's office is going to pick up the phone and call all of their patients that have that Advantage plan? No, they're not. What they're going to do is they're going to scotch tape a sign to the door that says, as of January 1st, we no longer accept Medicare Advantage plan number 1. Now, if you walk through the door during that time, you can get the message and call me and we can find you a plan that your doctor does take. But if you don't get the message, when are you going to find out about it? You're going to show up for your physical in May and you're going to show them your insurance card, and the lady on the other side of the counter is going to go, oh, no, I'm sorry. We stopped accepting that insurance back in January. You're now locked into it for the whole year. And so now what do? You either pay cash out of your pocket for something that should be free under that insurance plan, or you go find a new doctor. And who wants to do either one of those two things? Now, there's some good things about these plans. There's some semi-redeeming factors. Number one, they do limit your out-of-pocket costs. Remember, with original Medicare, there's no limit. With these plans, it varies depending on the plan that you pick. There's going to be somewhere between about a $4,000 and $7,000 out-of-pocket maximum, annual out-of-pocket maximum. Some of the plans do still provide the prescription drug coverage. Some of them don't, though, so you have to be careful. Make sure you understand what you're getting into. Some of them still do provide some very basic dental and vision services. So you might get one teeth cleaning a year and one pair of glasses every other year. You're not going to get any kind of major dental coverage, though. It's just really just a cleaning. And some of them still do offer that free health club membership. If you've ever heard your friends talking about silver sneakers, that's what that is. It gets you a membership to a local health club for free. Be sure you understand the value in that silver sneakers. This is the conversation that I have with people. What's the value? How much does a health club membership cost? On the high end, you've got places like Gold's Gym, probably around $40 to $50 a month. On the low end, you've got Planet Fitness, that's $10 a month. And for senior citizens, there's no contracts, no sign-up fees. It's $10 a month, month to month. So you've got a $120 a year value out of silver sneakers and a $7,000 bill if you get sick. So let's weigh the costs and the benefits of these plans. So these plans are right for two types of people, in my opinion. And the first one is the person that comes into my office or is chatting with me on the phone or Skype. And he says, Ron, I haven't been to the doctor in 30 years and I don't plan on going back anytime soon. And I don't want to pay for one of those Medicare supplements, so I'm just going to get that free HMO. And I've got some money in the bank, so I don't mind taking the risk with that out-of-pocket cost. It's not going to change my life to write a $7,000 check. And I don't have a doctor. He died 20 years ago, so I don't care what doctor they send me to if I do have to go. Well, Medicare Advantage might be right for that person. And then the other one is a person who simply just cannot afford any further monthly bills. And that's okay. If you can't afford it, you can't afford it. It's better than nothing. It's better than nothing, because to take the risk with Medicare alone and nothing else it's just too risky. This is better than nothing. But because you can't afford anything else, you're going to be forced to take that risk with that out-of-pocket cost. You're going to be forced to give up your choices of doctors and hospitals. And you're going to be forced to give up your control with your healthcare decision making. That's what it boils down to for a lot of people that I work with. Who's in control? Who's making your healthcare decisions? You and your doctors, or the accountants at the insurance company? That's Medicare Advantage plans. Are there any questions on that before we move on? So that kind of brings us towards the end of the presentation. We have covered the entire chart here. This is the original Medicare side of the chart where you get all the choices. You get an original Medicare A and B, you keep those. And then you get a Medicare supplement plan, also called Medigap, that pays your out-of-pocket cost up here. And a prescription drug plan to help out with the prescriptions. Now this is a side that gives you all the choices. So you can go to any doctor or any hospital that you choose as long as they accept original Medicare. And when you go, you have little or no out-of-pocket cost depending on the plan that you pick. And you have no managed care. So for almost everything, what the doctor orders is what you get. You don't have to get permission from the insurance company first. Your other choice is Medicare Advantage. Now, what happens here is for that calendar year, you've relinquished your Medicare benefits. You've chosen to be contracted out to this insurance company, and they're going to take care of you for that year. But for that year, Medicare, original Medicare, the government is out of the picture. So what happens here is you pay a little bit less per month, but what do you do in exchange for that? You take on a much greater out-of-pocket risk. You give up your choices of doctors and hospitals, and you give up your control with your healthcare decision making. So it's a tough choice sometimes, but I'm here to help you with that choice. And remember, once you make that choice, you may not be able to go back, because if you pick a Medicare Advantage plan, some people will come into my office and they will say, Ron, I'm healthy now. I'm just going to get one of these Medicare Advantage plans, one of the free HMOs, and if I get sick, then I'll just go get a Medicare supplement. Well, folks, it doesn't work like that. Once you're sick, you may not be able to get a Medicare supplement, and you may be stuck with that HMO that's not paying for your treatments. So it's very important that you make a wise decision now when you've got the opportunity, because once you have the Medicare Advantage plan, you may not be able to go back to the original Medicare side and get a Medicare supplement.